Hello, my friends. My name is Dr. Richard Caldwell, and at 83 years old, I'm still practicing dentistry 3 days a week here in beautiful Denver, Colorado. You might wonder why someone my age hasn't retired to a golf course somewhere warm. The truth is, I love what I do, and more importantly, I have something urgent to share with you that could change how you think about dental care forever. After 4 decades of looking into thousands of mouths, I've discovered something that might shock you. Much of what we've been taught about dental care, especially for those of us over 65, isn't just wrong, it's potentially harmful. I know that sounds impossible coming from a dentist, but please, hear me out. What I'm about to tell you could save your teeth, your health, and possibly even your life. Just last Tuesday, I had a patient walk into my office, Mrs. Helen Patterson, 78 years old. She'd been following every piece of conventional dental advice to the letter for decades. Brushing 3 times a day, using the strongest whitening toothpaste she could find. Scrubbing her teeth with a firm bristled brush until her gums bled. "Doctor," she said to me, tears in her eyes, "I've done everything right, so why are my teeth falling out?" Helen's story broke my heart because I've seen it hundreds of times. And here's the most disturbing part. 20 years ago, that would have been my story too. Yes, you heard correctly. Even as a dentist, I nearly lost all my teeth by age 63 because I was following the same misguided advice I was giving my patients. You see, my dental education in the 1960s was built on assumptions that we now know are fundamentally flawed when it comes to aging teeth and gums. We were taught that more is always better: more brushing, stronger toothpaste, firmer brushes. We thought we were being thorough. We were actually being destructive. The turning point came when I met Dr. Kenji Nakamura during a dental conference in Tokyo in 1987. Dr. Nakamura was 85 at the time, and his teeth were absolutely perfect. Not just for his age, they would have been impressive on a 25-year-old. When I asked him about his secret, he smiled and said something that changed everything. In Japan, we say the nail that sticks up gets hammered down. The same is true for teeth. The gentler you are, the longer they last. That conversation led me down a research path that would consume the next 15 years of my career. I partnered with gerontologists at the University of Colorado, studied traditional dental practices and cultures with exceptional oral health longevity, and most importantly, I started really listening to my oldest patients, the ones who still had strong, healthy teeth well into their 80s and 90s. What I discovered was revolutionary. The conventional wisdom about dental care that works for younger people not only stops working after age 65, it becomes counterproductive. Our teeth and gums change as we age in ways that require a completely different approach. But here's the problem. Most dentists, and certainly most dental hygienists, have never been taught this. They're still using the same protocols for an 80-year-old that they use for an 18-year-old. Let me tell you about Mr. Frank Morrison, one of my most memorable patients. Frank came to me at age 89, and he had what I can only describe as the mouth of a much younger man. Strong teeth, healthy pink gums, no sensitivity. I was fascinated and asked him about his routine. Frank chuckled and said, "Doc, I brush my teeth once a day, very gently, with the softest brush I can find. I use regular toothpaste, nothing fancy. And I never, ever brush right after eating. My grandfather taught me that said it was like scrubbing a sunburn." Frank's grandfather, it turns out, was wiser than most modern dental schools. After researching Frank's approach, I realized he was instinctively following principles that align perfectly with what we now understand about aging oral tissues. But it took me years to piece together why his simple method worked so well. The first revelation came when I started examining the pH levels in my patients' mouths at different times of day. After meals, especially those containing acidic foods or drinks, the mouth becomes a hostile environment for teeth. The enamel, that hard protective outer layer, temporarily softens. It's nature's way of allowing our saliva to remineralize and repair microscopic damage. But here's the critical part. During this vulnerable period, which lasts 30 to 60 minutes after eating, brushing your teeth is like taking sandpaper to wet clay dot. I remember the day this clicked for me. I was treating Robert Jenkins, a 72-year-old retired teacher who had been my patient for 15 years. Robert was obsessive about oral hygiene. He brushed within minutes of every meal and snack. Despite this dedication, his teeth were becoming increasingly sensitive, and his enamel was wearing away at an alarming rate. When I suggested he try waiting an hour after meals before brushing, he looked at me like I'd suggested he stop bathing. "Dr. Caldwell," he said, "I've been brushing after meals for 60 years. My mother would roll over in her grave if she knew I was walking around with dirty teeth. But Robert trusted me enough to try it for 3 months. When he came back for his next visit, the change was remarkable. His sensitivity had decreased significantly, and for the first time in years, I didn't see any new enamel erosion. Robert's success led me to start recommending delayed brushing to more patients, but I quickly learned that timing wasn't the only issue. The tools we use matter just as much as when we use them. Margaret Thompson, 76, had been using the same firm bristled toothbrush for decades. "I like to feel like I'm really cleaning," she told me. The problem was, Margaret's gums had been steadily receding, exposing the sensitive root surfaces of her teeth. This is where understanding the aging process becomes crucial. As we get older, our gum tissue becomes thinner and less elastic. The collagen that gives young gums their resilience breaks down over time. By age 70, gum tissue can be 40% thinner than it was at age 30. Using a firm brush on aging gums is like using a wire brush on delicate fabric. You'll get it clean, but you'll destroy it in the process. I switched Margaret to an ultra-soft toothbrush and taught her a gentle circular brushing technique. Instead of the vigorous back-and-forth scrubbing she'd been doing, I showed her how to hold the brush at a 45-degree angle and make small, gentle circles. "Think of it like dusting a priceless antique," I told her. "You want to remove the dust without damaging the surface." 6 months later, Margaret's gums had stopped receding and had actually begun to thicken slightly in some areas. But the most telling change was in her comfort level. "Doctor," she said, "I haven't had to avoid cold drinks in months. I forgot what it was like to enjoy ice cream without pain." The toothpaste revelation came through a patient named David Chun, a 68-year-old engineer who had been using whitening toothpaste religiously for 10 years. David came to me with severe tooth sensitivity and what he described as electric shocks whenever he drank anything cold. When I examined his teeth under magnification, I could see that his enamel had become translucent from overuse of abrasive whitening agents. This was my introduction to understanding how dramatically our dental needs change with age. The enamel that protects our teeth naturally thins as we get older. It's not just wear and tear, it's a biological process. By our 70s, our enamel can be 15 to 20% thinner than it was in our youth. Using abrasive whitening toothpaste on aging enamel is like using steel wool on an already thin piece of glass. I switched David to a gentle, non-abrasive toothpaste formulated for sensitive teeth. The difference was dramatic. Within 2 weeks, his sensitivity began to improve. After 3 months, he could drink ice water without discomfort. "I thought I was just getting old," he told me. "I never imagined my toothpaste was the problem." But perhaps the most important discovery of my later career involves the connection between oral health and overall health in seniors. This isn't just about having a nice smile or being able to chew your food comfortably, though those things matter enormously. What I've learned is that the health of your mouth directly impacts your cardiovascular system, your brain function, your immune system, and even your longevity. Let me tell you about Eleanor Fitzgerald. An 81-year-old former nurse who came to me with what seemed like a simple gum infection. Eleanor had been experiencing some fatigue and shortness of breath, which she attributed to normal aging. Her physician had run some basic tests, but hadn't found anything obvious. During her dental examination, I discovered severe periodontal disease, the kind of deep gum infection that often goes unnoticed because it's not always painful. I treated Eleanor's gum disease aggressively with deep cleaning and antimicrobial therapy. 6 weeks later, she called my office, excited. "Dr. Caldwell," she said, "I feel 20 years younger. My energy is back, I'm sleeping better, and my doctor says my blood pressure has improved." Eleanor's experience wasn't unusual, I've seen this connection between oral health and systemic health hundreds of times. The science behind this connection is fascinating and terrifying. When you have active gum disease, your mouth becomes a gateway for bacteria to enter your bloodstream. These bacteria can travel to your heart, contributing to cardiovascular disease. They can cross the blood-brain barrier, potentially contributing to dementia and Alzheimer's disease. They can trigger system-wide inflammation, accelerating the aging process throughout your body. Research from the University of Colorado, where I've collaborated on several studies, shows that seniors with severe gum disease are twice as likely to develop heart disease and 3 times more likely to experience cognitive decline. But here's the encouraging news: it's largely preventable and often reversible with the right approach. This brings me to what I call the gentle revolution in senior dental care. After decades of research and clinical experience, I've developed a comprehensive approach that protects and preserves aging teeth and gums. It's based on 5 fundamental principles that challenge conventional dental wisdom. The first principle is what I call timing intelligence. Instead of brushing immediately after meals, which can damage temporarily softened enamel, I recommend waiting at least 30 minutes, preferably an hour. During this waiting period, rinse your mouth with plain water to remove food particles and neutralize acids. If you're uncomfortable with the feeling of unclean teeth, use an alcohol-free mouthwash, but avoid brushing until your enamel has had time to reharden. I learned this principle the hard way through my own experience. In my early 60s, I was still following the brush after every meal rule I'd learned in dental school. Despite being meticulous about my oral hygiene, my teeth were becoming increasingly sensitive. It wasn't until I started delaying my brushing that I experienced relief. The change was so dramatic that I began recommending it to patients, and the results were consistently positive. The second principle involves choosing the right tools for aging mouths. This means ultra-soft toothbrushes, gentle toothpastes, and proper technique. I recommend toothbrushes with bristles that are 3 times softer than regular brushes. The bristles should bend easily under gentle pressure if you have to press hard to bend them. They're too firm for aging gums. Toothpaste selection is equally critical. Avoid whitening toothpastes, which contain abrasive particles that can wear away thinning enamel. Instead, choose gentle formulations with fluoride levels between 1,000 and 1,500 parts per million. Fluoride becomes even more important as we age because it helps remineralize weakening enamel. Some of my patients benefit from prescription strength fluoride toothpaste, especially those with exposed root surfaces. The third principle is technique modification. The aggressive back-and-forth scrubbing that might work for young, resilient teeth and gums can be destructive for aging oral tissues. Instead, I teach my senior patients to brush gently in small circular motions, holding the brush at a 45-degree angle to the gum line. The goal is to disrupt bacterial plaque without traumatizing the tissues. I often tell patients to imagine they're cleaning a delicate piece of china. You want to remove the dirt without scratching the surface. This gentle approach not only prevents damage but actually cleans more effectively because it allows the bristles to get into the spaces between teeth and along the gum line without forcing the gums to recede. The fourth principle addresses frequency and duration. While younger people might benefit from brushing 3 times a day, aging teeth and gums often do better with twice daily gentle cleaning. More isn't always better. In fact, it can be harmful. Each brushing session should last about 2 minutes. But the emphasis should be on gentleness rather than duration or vigor. I remember treating James Patterson, a 74-year-old retired mechanic who prided himself on thorough oral hygiene. James brushed his teeth 4 times a day for 5 minutes each time, using a firm brush and whitening toothpaste. He thought he was being extra careful with his dental health. Instead, he was systematically destroying his teeth and gums. When I suggested he reduce his brushing to twice daily with an ultra-soft brush, he was skeptical. "Doc," he said, "less cleaning means more problems, right?" 3 months later, James was convinced. His gum recession had stopped progressing, his tooth sensitivity had decreased significantly, and his overall oral health had improved. "I spent my whole life thinking more was better," he told me. "Turns out I was wrong about a lot of things." The fifth principle involves understanding the unique nutritional needs of aging teeth and gums. As we get older, our bodies become less efficient at absorbing nutrients, and our dietary needs change. This is particularly important for oral health because teeth and gums require specific nutrients to maintain their strength and resilience. Calcium and vitamin D are obviously important for bone health, including the jawbone that supports our teeth, but equally important are vitamin C for gum health, vitamin K2 for proper calcium utilization, and omega-3 fatty acids for their anti-inflammatory properties. I often recommend that my senior patients work with a nutritionist to ensure they're getting adequate levels of these nutrients. Mary Elizabeth Douglas, an 85-year-old former librarian, came to me with loose teeth and bleeding gums despite following good oral hygiene practices. When I asked about her diet, I discovered she'd been living primarily on soft processed foods since her husband's death 2 years earlier. We worked together to improve her nutrition, focusing on foods rich in the nutrients her teeth and gums needed. Combined with gentle oral care techniques, her oral health improved dramatically over the following months. But nutrition isn't just about what you eat, it's also about when and how you eat. Frequent snacking, especially on sugary or acidic foods, creates an environment in the mouth that's hostile to teeth. As we age, our saliva production often decreases, which means our natural defense against acid attacks is diminished. This makes dietary timing even more critical for seniors. I recommend that my older patients try to limit eating to 3 main meals plus 1 or 2 planned snacks, allowing time between eating episodes for the mouth to neutralize and recover. When they do snack, choosing tooth-friendly options like cheese, nuts, or vegetables is ideal. These foods actually help neutralize acids and provide beneficial nutrients for oral health. The connection between oral health and overall health becomes even more critical as we age. I've seen patients whose dental problems contributed to serious systemic health issues, and conversely, patients whose overall health dramatically improved when we addressed their oral health problems. Consider the case of William Rodriguez, a 77-year-old retired postal worker who came to me for routine dental care. During the examination, I discovered severe periodontal disease that William hadn't even realized he had. The infection was so advanced that bacteria were almost certainly entering his bloodstream regularly. I referred William to his physician for evaluation and began aggressive treatment of his gum disease. 3 months later, William's physician called me. William's chronic fatigue had resolved. His blood sugar control had improved dramatically, and markers of inflammation in his blood had decreased significantly. "I don't know what you did," the doctor said, "but William is like a different person." What I had done was eliminate a major source of chronic infection and inflammation that had been compromising William's entire system. This systemic connection works both ways. Patients with diabetes, for example, are more susceptible to gum disease. But gum disease also makes diabetes harder to control. It's a vicious cycle that can be broken with proper oral care. Similarly, patients taking multiple medications, common among seniors, often experience dry mouth as a side effect, which increases their risk of dental problems. Understanding these connections has made me a more effective dentist and has helped my patients achieve better overall health. I now routinely communicate with my patients' physicians, sharing information about oral health status and coordinating care when necessary. This collaborative approach has led to better outcomes for everyone involved. Let me share another transformative case. Patricia Williams, an 83-year-old former teacher, came to me complaining of persistent bad breath and a metallic taste in her mouth. Her family had noticed that she seemed confused at times and was having trouble finding words. Patricia's daughter was worried about dementia. During my examination, I found extensive gum disease and several abscessed teeth that Patricia hadn't even realized were infected. After treating Patricia's infections and teaching her proper oral care techniques for seniors, her family noticed remarkable improvements. The bad breath disappeared, her mental clarity improved, and her word-finding difficulties resolved. While I can't claim that dental treatment prevented dementia, the connection between oral infection and cognitive function is well established. And Patricia's improvement was dramatic. These experiences have convinced me that oral health is inseparable from overall health, especially in seniors. The mouth is not an isolated system. It's intimately connected to the rest of the body through blood circulation, nerve pathways, and the immune system. When we take care of our mouths properly, we're taking care of our entire bodies. This holistic understanding has also changed how I approach preventive care for seniors. Regular dental visits become even more important as we age, not just for cleaning teeth, but for monitoring overall health. I can often detect early signs of systemic diseases during routine dental examinations. Changes in gum color might indicate cardiovascular problems. Sudden tooth mobility could suggest osteoporosis. Oral lesions might be early signs of autoimmune diseases. But prevention is always better than treatment, and the gentle care principles I've developed can help prevent many of these problems from developing in the first place. Let me walk you through a typical day of optimal oral care for someone over 65. The day begins with gentle oral care, but not immediately upon waking. I recommend that my senior patients drink a glass of water first, allowing their saliva production to normalize after the dry period of sleep. After 15 to 20 minutes, they can begin their morning oral care routine. Start with an alcohol-free mouthwash to loosen debris and bacteria. Then, using an ultra-soft toothbrush and gentle fluoride-containing toothpaste, brush for 2 minutes using small circular motions. Pay special attention to the gum line, where bacteria tend to accumulate, but be gentle. The goal is to disrupt bacterial colonies without traumatizing the tissues. After brushing, floss gently using either traditional dental floss or specialized flossing tools designed for seniors. Many of my older patients find that water flossers are easier to use and less traumatic to sensitive gums. The key is consistency rather than perfection. Daily flossing, even if not perfect, is infinitely better than occasional thorough flossing. Finish the morning routine with another rinse of mouthwash or plain water to remove any debris loosened during cleaning. Some patients benefit from using a tongue scraper to remove bacteria from the tongue surface, which can contribute to bad breath and oral infections. Throughout the day, the focus shifts to protection and maintenance. After meals, rinse with water to remove food particles and begin the neutralization process. Avoid brushing for at least 30 minutes, longer if you've consumed acidic foods or drinks. If you need to freshen your breath, use sugar-free gum or mints containing xylitol, which actually helps fight cavity-causing bacteria. The evening routine mirrors the morning routine, but with additional attention to removing the day's accumulation of plaque and bacteria. Some of my patients benefit from using a prescription fluoride gel at bedtime, especially if they have exposed root surfaces or a history of cavities. This routine might seem less intensive than traditional recommendations, but it's actually more effective for aging mouths. The emphasis on gentleness and timing allows the mouth's natural protective mechanisms to function optimally while removing harmful bacteria and debris. I've been refining this approach for over 20 years now, and the results speak for themselves. Patients who follow these principles consistently maintain healthier teeth and gums well into their 80s and 90s. More importantly, they experience better overall health and quality of life. Take the case of Robert and Nancy Chun, a couple in their late 70s who have been my patients for 15 years. When they first came to me, both were following conventional dental advice, and both were experiencing significant oral health problems. Robert had severe sensitivity and receding gums. Nancy had lost several teeth and was considering dentures. I introduced them to the dental care principles gradually, explaining the science behind each recommendation. They were skeptical at first, like many patients. They associated thorough cleaning with vigorous scrubbing. But they trusted me enough to try the new approach. 5 years later, both Robert and Nancy have maintained all their remaining teeth. Robert's sensitivity has resolved completely, and Nancy's gum health has improved to the point where she no longer needs periodontal therapy. More importantly, both report feeling more energetic and experiencing fewer health problems overall. Dr. Caldwell, Nancy told me at their last visit, "I used to dread coming to the dentist because there was always bad news. Now I actually look forward to our visits because I know you're going to tell me I'm doing well." This transformation isn't unusual. I see it regularly with patients who embrace the gentle care approach. But perhaps the most compelling evidence for this approach comes from my own experience. At age 83, I still have all my teeth except for 2 wisdom teeth that were removed in my youth. My teeth are strong, my gums are healthy, and I can eat anything I want. More importantly, my overall health is excellent for someone my age. I attribute much of this to the oral care principles I've developed and followed for the past 2 decades. The research supporting these principles continues to grow. Studies from institutions around the world confirm that gentle oral care is more effective for seniors than aggressive approaches. Research on the oral systemic health connection continues to reveal new links between mouth health and overall well-being. The evidence is overwhelming. The way we've been taught to care for our teeth isn't optimal for aging mouths. Yet changing established habits and beliefs is challenging, even when the science supports the change. I've had patients argue with me, insisting that their grandfather's advice to brush hard and often must be correct because he lived to 95. What these patients don't realize is that their grandfather probably had very different teeth and gums at 95 than they would have using modern diets and lifestyles. Our ancestors ate differently, lived differently, and aged differently than we do today. The oral care advice that worked for previous generations may not be optimal for us. We need approaches that account for our current understanding of biology, our modern diets, our longer lifespans, and our desire to maintain function and quality of life well into our later years. This is why I continue to practice at 83 and why I'm passionate about sharing this information. Every day I see seniors who could dramatically improve their oral health and overall well-being with simple changes to their daily routines. The tragedy is that many of them don't know these options exist because they're still receiving advice based on outdated understanding. The dental profession is slowly beginning to recognize the need for age-specific oral care protocols. But change comes slowly to any medical field. In the meantime, individuals can take charge of their own oral health by understanding and applying these principles. If you're over 65 and experiencing tooth sensitivity, gum recession, loose teeth, or chronic bad breath, You don't have to accept these problems as inevitable consequences of aging. With the right approach, you can maintain healthy teeth and gums for life while supporting your overall health and vitality. The key is understanding that aging mouths have different needs than young mouths and adjusting your care accordingly. Be gentle with your teeth and gums. They've served you well for decades and deserve respectful treatment. Time your oral care to work with your mouth's natural protective mechanisms rather than against them. Choose tools and products designed for aging oral tissues. And remember that your mouth is connected to the rest of your body in ways that become more important as you age. Most importantly, don't be afraid to question conventional wisdom, even when it comes from healthcare professionals. The field of dentistry, like all areas of medicine, continues to evolve as we learn more about how the human body works. What we thought was best practice 20 years ago may not be optimal today, and what we recommend today may be refined further as our understanding grows. I encourage you to discuss these principles with your dentist or dental hygienist if they're not familiar with age-specific oral care approaches. Share this information with them or seek out practitioners who specialize in geriatric dentistry. Your oral health is too important to leave to outdated protocols. Remember, it's never too late to improve your oral health. I've seen dramatic improvements in patients who made these changes in their 80s and 90s. Your teeth and gums have remarkable healing capacity when given the right conditions to thrive. As I continue my practice here in Denver, now well into my 9th decade, I'm constantly amazed by the resilience of the human body when we treat it with understanding and respect. The principles I've shared with you today represent not just my professional recommendations, but my personal practice. They've allowed me to maintain my health and continue doing work I love at an age when many of my contemporaries have been sidelined by health problems. Your oral health is an investment in your future, your ability to eat the foods you enjoy, to speak clearly, to smile confidently, and to maintain the overall health that allows you to live life fully. With the right approach, that investment can pay dividends for decades to come. Thank you for allowing me to share these insights with you. Here's to your health, your happiness, and your beautiful smile for many years to come.